Attention! In medicine, there is a substance that we all underestimate. The impact of this substance on the human body has turned out to be far broader than what was believed for decades. Yes, everyone knows it and usually associates it with a single function. In reality, modern research reveals its enormous role, which in terms of importance is comparable to the action of vitamin D. We are talking about melatonin, a hormone that we should have stopped viewing solely as a sleep regulator long ago. Today I propose to look at melatonin more deeply, how it works, where it is produced, what functions it performs, and why it may be beneficial in a wide range of conditions, from sleep disturbances to disorders of the digestive, cardiovascular, and nervous systems. To understand the scale of its influence, we should first turn to the properties most people already know: melatonin and sleep. Melatonin indeed helps people who experience difficulty falling asleep. Modern research confirms that its use reduces the time needed to fall asleep and improves overall sleep quality. This is associated in part with a decrease in norepinephrine secretion, one of the hormones that maintains wakefulness. It is important to emphasize that melatonin is not a sleeping pill, meaning it does not cause dependence, does not affect consciousness, and it adjusts rhythms rather than suppressing the brain. In addition, melatonin contributes to a natural, mild reduction in body temperature, which is a physiological signal that initiates the transition of the body into night mode. These properties are useful not only for insomnia, but also for jet lag and for people whose work disrupts circadian rhythms. Typically, a dose of 2-3 milligrams about an hour before sleep is used for these purposes. Such an amount supports the natural mechanisms of falling asleep appropriately. Immune system and anti-inflammatory properties. Along with helping the body prepare for nighttime rest, melatonin has a significant impact on the immune system. Melatonin supports the balance between an effective immune response and the control of inflammation. In other words, if immunity is weak, it stimulates it, increasing resistance to infections. If inflammation is excessive or in autoimmune conditions, it reduces the overproduction of pro-inflammatory cytokines, protecting tissues from damage caused by a hyperactive immune response. Melatonin is a strong antioxidant. It neutralizes free radicals that may damage immune cells. The scientific literature emphasizes that melatonin can reduce the activity of pro-inflammatory molecules such as interleukins 1 and 8. This effect is considered one of the most important properties of melatonin. Since the level of chronic inflammation increases with age, its influence is particularly relevant for older adults. Digestive system. Melatonin was discovered in 1917 and found both in humans and in plants. It is produced not only in the pineal gland, but also in many other parts of the body, primarily in the intestines. Scientists note that its concentration in the intestines is 400 times higher than in the pineal gland. The high concentration of melatonin in the intestines is especially interesting because it indicates a role far beyond sleep regulation. Research confirms its involvement in maintaining gastrointestinal health. In one clinical trial, patients with GERD were given 3 milligrams of melatonin before bedtime daily. The course lasted 8 weeks. By the end of the first month, more than half of the participants, 57%, reported a marked reduction in heartburn symptoms. And after 2 months, improvements were observed in all patients without exception. Notably, the positive effect persisted even in those who took only melatonin without additional therapy. When combined with traditional medications, the result became even more pronounced. There is also evidence that melatonin has a beneficial effect on irritable bowel syndrome. Another study showed that in people suffering from irritable bowel syndrome, taking 3 milligrams of melatonin before bedtime for 2 weeks significantly reduced the severity of abdominal pain. It is assumed that this is related both to the analgesic properties of melatonin and to its ability to regulate intestinal motility. Melatonin also exhibits gastroprotective effects. Interesting data were obtained in a study where standard therapy for duodenal ulcers associated with Helicobacter pylori was supplemented with melatonin at a dose of 5 milligrams twice a day for 3 weeks. Adding melatonin accelerated ulcer healing. The authors attribute this result to the anti-inflammatory properties of the hormone and to its ability to increase leptin levels, a substance involved in the formation of new blood vessels and in supplying tissues with oxygen and nutrients necessary for recovery. The findings presented here demonstrate the potential role of melatonin in slowing the development of liver fibrosis and its possible progression to cirrhosis and hepatocellular carcinoma. In a 2020 study, taking 6 milligrams of melatonin 1 hour before sleep for 3 months improved liver function markers, reductions in ALT and AST, and decreased the degree of fatty degeneration. The authors note the potential benefit of melatonin in fatty liver disease, although additional studies and large-scale observations are needed for clinical recommendations. Effects on the cardiovascular system. A meta-analysis of 5 studies showed that melatonin has a mild antihypertensive effect. It lowers both systolic and diastolic blood pressure by about 3.5 millimeters of mercury. This occurs due to decreased activity of the sympathetic nervous system, reduced norepinephrine levels, and increased nitric oxide synthesis, which promotes vasodilation. The studies used doses from 3 to 10 milligrams daily for 6 to 12 weeks. A comprehensive analysis of 8 studies from 2018 showed that melatonin may reduce triglyceride levels by an average of 31.5 milligrams per deciliter. The greatest effect was observed when at least 8 milligrams was taken daily for a minimum of 2 months. These data make melatonin an interesting component to consider in the context of lipid profile correction, although it is important to take into account overall treatment strategies and individual characteristics. You may be surprised, but preclinical studies show that melatonin slows the formation of atherosclerotic plaques. This effect is attributed to its antioxidant action and its influence on the structure of the vascular wall. Although laboratory results cannot be directly extrapolated to clinical practice, they serve as a basis for further research. Melatonin and diabetes. A 2021 study states that melatonin may reduce fasting glucose, glycated hemoglobin, and insulin resistance. At the same time, the effect is moderate and does not replace primary diabetes treatments, so melatonin should be considered an auxiliary tool. It is worth noting that melatonin administration also reduces diabetes-induced neuropathy. Mental health in postmenopausal women and Alzheimer's disease. Studies from 2023-2024 showed that melatonin can alleviate symptoms of depression and anxiety in postmenopausal women. This opens possibilities for supporting mental health during this stage of life. Fat mass decreased and muscle mass increased in patients who took melatonin for 1 year, as a possible result of a beneficial effect on lipid metabolism. This meta-analysis of results convinces us of the effectiveness of melatonin in treating the mild stage of Alzheimer's disease. Migraine. A 2020 publication found that taking 3 milligrams of melatonin before sleep reduced the frequency of migraine episodes. This effect is explained by its influence on neurotransmitters and its analgesic action, which makes melatonin interesting for migraine prevention. Anti-cancer potential. It is also interesting to note that melatonin has anti-cancer properties. There are data showing that melatonin may increase tumor sensitivity to chemotherapy, limit the penetration of cancer cells into the vascular system and metastasis, reduce the side effects of anti-cancer therapy. At the same time, further studies are needed to confirm clinical efficacy, and melatonin cannot currently be considered an independent anti-cancer treatment. A logical question arises. If melatonin is so beneficial, how can we increase its level? First, through foods containing melatonin, almonds, pistachios, grape seeds, sunflower and pumpkin seeds, flax seeds, cherries, cranberries, beans, black and red rice, porcini mushrooms, milk thistle. Second, through foods rich in tryptophan, the precursor of melatonin, salmon, poultry, beef, eggs, pumpkin, and sesame seeds, all of these can support endogenous melatonin production. Third, by taking melatonin supplements, the most effective method. They are divided into fast-release forms for falling asleep and extended-release forms for maintaining sleep throughout the night. Thus, melatonin is not merely a sleep hormone. It helps us fall asleep, supports immunity, protects the heart and blood vessels, and preserves our cells from aging. I wish for you not only to sleep well, but also to live in harmony with the rhythms of your body. See you in the next video.